All right, let's dive into hemodynamics. We're going to take what often feels like just a jumble of blood pressure numbers and turn it into something that makes sense, a predictable, logical system that really governs how blood flows and perfuses the entire body.
And that's really the big promise here. By the time we're done, these core formulas are going to feel totally intuitive. You'll see the common exam traps from a mile away, and those tricky clinical scenarios, they're finally going to start to click.
So, here's the game plan. We'll kick things off with the single most important equation in all of hemodynamics. Then, we'll get into the incredible power of resistance. After that, we'll map out the whole system, look at the forces on the vessel walls, and finally, bring it all home with some real-world clinical applications.
Okay, let's start with the master key. This one simple relationship is truly the foundation for everything else we're going to talk about. It is the code that unlocks how blood gets from point A to point B.
So here's the bottom line. Blood flow is a whole lot like electricity. You remember Ohm's law, right? Current equals voltage divided by resistance. Well, our circulatory system works the same way. Blood flow, which we call cardiac output, is all about the pressure pushing it forward divided by the resistance pushing back. For us, that simplifies to cardiac output is roughly equal to mean arterial pressure divided by total peripheral resistance. MAP is the push, TPR is the pushback. Simple as that. And that MAP, by the way, the single best sign of organ perfusion, is your diastolic pressure plus about a third of the pulse pressure.
If there's one phrase you walk away with today, let it be this one. Pressure pushes, radius rules. Yeah, the pressure gradient is what gets the blood moving, but as you're about to see, it's the radius of the blood vessels that really, truly calls the shots.
Okay, let's really dig into that second part of the phrase, radius rules. Because out of all the things in our system, the radius of our small arteries, the arterioles, is without a doubt the most powerful and fastest way our body controls blood pressure. The math behind this is it's wild. Poiseuille's law shows us that resistance is inversely proportional to the radius to the fourth power. That tiny little 4 is the secret sauce. It means that even a ridiculously small change in the diameter of a vessel has this massive exponential impact on resistance. So let's really put this to the test. Just think about it for a sec. If we clamp down on an arteriole and cut its radius in half, what does that to the fourth power thing actually do? I mean, does resistance double? Does it go up by 4?
It goes up 16-fold. That's not a typo. 16 times the resistance from just a 50% change in radius. This is exactly why tiny shifts in vessel tone can cause these huge, dramatic swings in blood pressure. This is why radius rules.
And this isn't just some abstract physics problem, right? This plays out in the clinic every single day. When vessels clamp down, blood pressure skyrockets. When they open up, pressure plummets. It even explains why the thickness of blood matters. In polycythemia, that thick, viscous blood increases resistance, putting patients at risk for ischemia. And in anemia, the blood is thinner, which lowers resistance and can cause so much turbulence you can actually hear it as a flow murmur.
Okay, so we've got the forces down. Now let's zoom out and look at the actual roadmap of the circulatory system. There are a couple of key ideas here that honestly can trip a lot of people up. First up, let's get our terms straight because this is a big one. Velocity is about how fast the blood is moving, distance over time. But flow, which is our cardiac output, is about how much blood is moving. That's volume over time. They're related for sure, but they're not the same thing.
And that difference leads us straight to what's called the capillary paradox. So check this out. A single capillary is microscopic, right? But if you add up the area of all the capillaries in your body, you get this gigantic total area, way, way bigger than the aorta. Since the total flow through the system is constant, that huge area means the blood has to slow way, way down. It's moving at its absolute slowest in the capillaries. And this is a brilliant design. It gives all that time needed for oxygen and nutrients to move in and out of the tissues.
The system's also built for incredible efficiency. While blood flows in series through any one organ, all the major organs themselves are hooked up in parallel, like houses on a street. This is a crucial safety feature. Adding more parallel pathways actually lowers the total resistance of the whole system. This makes sure every organ gets a stable supply of blood without totally overwhelming the heart.
So far we've been talking about the blood flowing through the pipes. Now let's talk about the pipes themselves, the vessel walls. We need to think about the forces acting on them. This is all about tension and stress. And the rule book for this is the law of Laplace. It tells us that the tension or the stress on the wall of a vessel depends on the pressure inside and its radius, all divided by how thick the wall is.
This one formula explains so much about heart and vessel disease.
Let's see it in action. In dilated cardiomyopathy, the heart gets bigger, the radius goes up, and that just cranks up the wall tension and the heart's oxygen demand. With chronic high blood pressure, the heart muscle actually gets thicker. It hypertrophies as a way to fight back and decrease that wall tension. And in an aneurysm, you get the worst of both worlds. The radius gets bigger and the wall gets thinner, a deadly combo that sends tension and the risk of rupture through the roof.
And this right here, this is a huge, high-yield exam trap. It's so tempting to think that high pressure is what makes an aneurysm grow. But the key, according to Laplace's law, is that as the aneurysm gets bigger, its radius increases, and that itself increases the wall tension. It creates this dangerous, vicious cycle where expanding leads to more tension, which then leads to more expanding.
All right, let's land the plane. In this last section, we're going to tie everything together. We've gone through the physics. Now let's look at how the body actually controls this whole system and how we can use these principles to figure out what's wrong with our patients.
Think of the baroreceptor reflex as the body's rapid response team, its internal BP thermostat. You've got these sensors in your carotid arteries and your aorta that are constantly monitoring pressure. If the pressure creeps up too high, they fire off signals to the parasympathetic system to chill things out, lower the heart rate, open up the vessels. If pressure drops, they fire less, which kicks the sympathetic system into high gear to speed up the heart and clamp down on vessels. It's just this elegant, instantaneous feedback loop.
Okay, time to put on your detective hat. Here's a quick case. You've got a 68-year-old patient whose blood pressure is 170/70. Now, the first thing you should notice is that massive pulse pressure, 100 points, but they don't look fluid overloaded. So, using what we've just talked about, what's really going on here?
The answer? It's the arteries. They're stiff. This is all about decreased arterial compliance. See, as we get older, our arteries lose their elasticity. They just can't stretch to absorb that big push of blood from the heart, so the systolic pressure goes way up. The diastolic pressure, though, might be totally normal or even low. This is your classic isolated systolic hypertension, and it's a disease of stiffness, not just resistance or too much volume.
Okay, let's do a quick knowledge check to make sure this stuff is sticking. Take a second and see if you can fill these in. Number 1, cardiac output is about MAP divided by TPR. Number 2, resistance is proportional to 1 over the radius to the 4th power. Number 3, the slowest velocity is in the capillaries. And number 4, MAP is your diastolic plus 1/3 of the pulse pressure. How you do? Hopefully those are starting to feel second nature.
You know, the real test of mastering this is being able to rebuild these ideas from scratch, from first principles. To help you do just that, make sure you download the high-yield rotes and the mind map that go along with the session. Use them to practice, to review, and to make all these connections completely automatic. You've got this. Keep up the great work.